Watch out for these early signs of diabetes. Did you know that diabetes affects over 500 million people worldwide and is becoming one of the biggest global health threats? This often silent condition can start manifesting subtly, with symptoms that are easily overlooked. In this video, we'll explore the early signs that you might have diabetes and how to identify them before they escalate into bigger problems. We'll discuss everything from excessive thirst to dark patches on the skin, revealing how these signs can indicate an imbalance in your body. Remember, while this video offers valuable insights, seeking medical help is crucial for an accurate diagnosis and effective treatment. Stay tuned until the end to learn how to take action and protect your health. Number 1. Excessive thirst. Excessive thirst, known as polydipsia, is one of the first warning signs of diabetes. This symptom occurs when blood glucose levels are elevated, overwhelming the kidneys, which are responsible for filtering and reabsorbing glucose. When this capacity is exceeded, excess glucose is eliminated in the urine, carrying away a significant amount of water and leading to dehydration. The body responds to this loss by triggering intense thirst as a mechanism to rehydrate and compensate for the lost fluids. Additionally, this persistent thirst may be accompanied by a dry mouth and, if untreated, can lead to more severe complications, such as electrolyte imbalances. It's crucial to be attentive to this symptom, as it can indicate a significant metabolic imbalance that requires medical evaluation and possibly adjustments in diet and hydration to prevent diabetes progression. Number 2. Frequent urination. Frequent urination, known as polyuria, is a common symptom in the early stages of diabetes. This increase in urination is a direct response to hyperglycemia, where excess blood glucose is not adequately absorbed by the body and ends up being filtered by the kidneys. Excess glucose attracts water into the renal tubules by osmosis, resulting in a larger volume of urine. Moreover, polyuria may be more pronounced at night, a condition called nocturia, which disrupts sleep and affects quality of life. This symptom should not be ignored, as it not only indicates glycemic control issues but can also lead to dehydration and electrolyte loss, contributing to fatigue and muscle weakness. Monitoring urinary frequency and fluid intake is crucial, and medical evaluation is necessary to identify the underlying cause and prevent long-term complications such as renal failure or metabolic imbalances. Number 3. Excessive hunger. Excessive hunger, or polyphagia, is an early sign of diabetes that often goes unnoticed. This symptom arises because, despite high blood glucose levels, the body's cells cannot effectively use the glucose due to insulin deficiency or resistance. This leads to a false sense of hunger, as the body perceives a lack of cellular energy as a need for more food. Consequently, individuals experience constant and intense hunger, even after consuming large amounts of food. This vicious cycle not only worsens hyperglycemia but can also lead to weight gain, creating additional health risks. Polyphagia, coupled with other symptoms like excessive thirst and weight loss, can be a significant indicator of metabolic dysregulation. Recognizing and understanding this symptom is crucial for early diabetes detection and for developing dietary and therapeutic strategies to restore glycemic balance and prevent more severe complications. Number 4. Unexplained weight loss. Unexplained weight loss is a concerning symptom often associated with undiagnosed diabetes. This condition occurs because, in a state of hyperglycemia, the body cannot use glucose as an energy source due to insulin deficiency or inefficacy. As a result, it starts breaking down fat and protein reserves to meet its energy needs, leading to a loss of body mass. Additionally, glucose that should be utilized by the cells is excreted in the urine, causing a significant loss of calories. This weight loss can be rapid and occurs even if appetite is increased, which is paradoxical. This combination of factors makes weight loss an important warning sign, especially when there is no obvious explanation, such as changes in diet or physical activity. Recognizing this body change is crucial for early intervention, as untreated continuous catabolism can lead to muscle weakness, malnutrition, and other serious complications related to uncontrolled diabetes. Number 5. Extreme fatigue. Extreme fatigue, or persistent tiredness, is a common symptom in diabetes patients and can be debilitating. This type of fatigue occurs because, despite having glucose available in the blood, the body's cells cannot absorb it effectively due to insulin deficiency or resistance. Without glucose to generate energy, the body starts functioning inefficiently, resulting in a constant sense of exhaustion, regardless of rest or food intake. Additionally, dehydration caused by polyuria and loss of essential nutrients contribute to fatigue, worsening physical and mental weakness. This fatigue may also be exacerbated by chronic inflammation, common in people with diabetes, and the impact of disrupted sleep due to nocturia. Ignoring this symptom can delay diagnosis and treatment, allowing the condition to worsen. Therefore, extreme fatigue should be carefully investigated to ensure its origin is identified and that appropriate treatment is initiated to restore the patient's quality of life. Number 6. Blurred vision. Blurred vision is an early symptom of diabetes, resulting directly from fluctuations in blood glucose levels. When blood sugar is high, excess glucose can accumulate in the eye's lens, altering its shape and thus its focusing ability. This temporary change in lens curvature causes visual distortion, leading to blurred vision. Additionally, diabetes can affect the blood vessels in the retina, a condition known as diabetic retinopathy, which, if untreated, may progress to permanent vision loss. Blurring can vary throughout the day, reflecting changes in blood glucose levels, and is often underestimated as a common sign of eye fatigue. However, this visual symptom should be regarded as a warning for the need for immediate medical assessment, as proper glucose control can reverse initial blurring and prevent severe eye complications. Early detection and appropriate management are crucial to protect ocular health and maintain the patient's quality of life. Number 7. Slow wound healing. Slow wound healing is an important clinical sign in diabetes, often indicating poor blood glucose control. This condition occurs due to the negative impact of hyperglycemia on the circulatory and immune systems. Excess glucose damages blood vessels, reducing blood flow to injured areas, which limits the supply of oxygen and essential nutrients for tissue repair. Additionally, diabetes impairs white blood cell function, decreasing the body's ability to fight infections and respond effectively to injuries. This combination not only delays healing but also increases the risk of secondary infections, which can lead to serious complications such as ulcers and, in extreme cases, amputations. Slow wound healing is an indicator that diabetes is significantly affecting the patient's vascular and immune health, and requires urgent medical intervention. Strict glucose control, along with specialized wound care, is essential to prevent complications and ensure proper recovery. Number 8. Frequent infections. Frequent infections are a worrying sign of poorly controlled diabetes and indicate that the immune system is compromised due to chronic hyperglycemia. Excess glucose in the blood creates a favorable environment for the growth of bacteria and fungi, making the body more susceptible to infections, particularly in the skin, urinary tract, and oral cavity. Moreover, hyperglycemia impairs the function of white blood cells, which are crucial for defending against pathogens, weakening the immune response and prolonging recovery time from infections. These infections can be recurrent and difficult to treat, requiring more aggressive medical interventions such as prolonged use of antibiotics or antifungals. In severe cases, poorly managed infections can lead to systemic complications such as sepsis. The occurrence of frequent infections is a sign that diabetes management needs reevaluation, focusing on improving glucose control, strengthening the immune system, and implementing stringent preventive measures to avoid new infections and maintain overall health. Number 9. Tingling or numbness in hands and feet. Tingling or numbness in the hands and feet, known as peripheral neuropathy, is a common complication of diabetes resulting from nerve damage caused by prolonged high blood glucose levels. This condition occurs when chronic hyperglycemia deteriorates the small nerve fibers, especially those in the extremities, impairing nerve signal conduction. Early signs include a burning sensation, tingling, or numbness, which can progress to loss of sensitivity or intense pain. These symptoms are particularly concerning because reduced sensitivity can lead to unnoticed foot injuries, which may develop into ulcers and severe infections. Diabetic neuropathy can also impact coordination and balance, increasing the risk of falls. To minimize these risks, strict glucose control and regular foot and hand examinations are crucial to ensure any injury or change is addressed early. Early detection and appropriate management of neuropathy are essential to prevent more severe complications and improve the patient's quality of life. Number 10. Dark patches on the skin. Dark patches on the skin, known as acanthosis nigricans, can be an early sign of insulin resistance, often associated with type 2 diabetes. These patches usually appear in skin folds, such as the neck, armpits, and groin, and are caused by hyperinsulinemia, where elevated insulin levels in the blood stimulate increased melanin production, the pigment responsible for skin color. Additionally, insulin resistance can affect cellular metabolism, leading to changes in skin texture and the appearance of velvety in darkened areas. The presence of these patches signals that the body is struggling to regulate glucose and insulin levels and often precedes the development of type 2 diabetes. Monitoring these skin changes, along with blood glucose testing and a suitable dietary and therapeutic approach, is crucial for early diagnosis and treatment of insulin resistance, helping to prevent progression to diabetes and its associated complications. Now that we've explored the early signs of diabetes, such as excessive thirst, frequent urination, and extreme fatigue, it's crucial to remember that recognizing these symptoms early can make a significant difference in your health. These signs are your body's way of alerting you, and taking prompt action can prevent severe complications and improve your quality of life. Early detection and glucose control are vital to prevent the disease's development and its consequences. However, despite all the valuable information shared, it's essential to seek medical advice for an accurate diagnosis and appropriate treatment plan. Your health is the priority, and being well-informed is the first step toward keeping diabetes under control. If you notice any of these symptoms, don't hesitate to consult a healthcare professional. Take care and stay vigilant about your body's signals. Thanks for watching until the end. Don't forget to like, subscribe to the channel and share with your friends.